In this video, we will continue our journey in the field of applied psychology. Moving on to the part, to the next part, let us summarize briefly what we have looked at. As we said before, psychology is a profession as well as a science. And because psychology is a profession, we have an applied psychologist. And we can define applied psychologist as the person who tries to put basic principles of overt and covert behavior that discovered by the basic psychologist into practice. So they apply the principles of psychology in order to be able to help humans in one way or another. And they apply psychology in industrial situations so they can deal with the problems of vocational adjustment, and they trying to find the best one for a job and the best job for one, and also they may serve in connection with institutions of learning such as schools, universities, faculties, and also they served with military organizations, industrial organizations, mental health institutions, and clinical settings. And over and above, they may occupy research positions in research centers. Also, we said that we will cover some about 7 subtypes of applied psychologists. They are sports psychologists, industrial psychologists, military psychologists, educational psychologists, clinical psychologists, counseling psychologists, psychoanalysts. Already we covered some about the first 4 subtypes: sports psychologist, industrial psychologist, military psychologist, educational psychologist. Today, we will continue our journey and try to define the following subtypes of applied psychologists. The remaining 3 subtypes of applied psychologists. They are clinical psychologists, counseling psychologists, and psychoanalysts. But before moving on to the next today's part, I would like to summarize what we said before about the first 4 subtypes. Sports psychologist, we defined it as a professional who can help athletes improve their performance and focus. And he works with sport players to help humans identify their challenges, work through hard times, and set goals. What about industrial psychologists? We defined industrial psychologists, or in the field of industrial psychology or industrial organizational psychology, as the field that applies psychologist scientific knowledge of human behavior in order to help determine which organizational and leadership techniques are most effective for a particular place of business. And they work with individual employees and or managers. They may help managers to discover the best methods to teach employees new processes, and they can help to find the best way for employees to work as a group, the best way to improve the company's performance and production by helping managers to achieve the company's goals, and they can find the best one for a job and the best job for one. And we covered 3 main points about military psychologists. We define military psychology as the research, design, and the application of psychological theories and the experimentation data towards understanding, predicting, and countering behaviors either in friendly or enemy forces or civilian population that may be undesirable, threatening, or potentially dangerous to the conduct of military operations. And as we said before, military psychology is applied towards counseling and the treatment of stress, fatigue, psychological traumas suffered as a result of military operations. And the last point, another use of military psychology is in interrogation. What about educational psychology? Educational psychology is the study of how humans learn in educational settings. Educational psychology tries to discover the effectiveness of educational interventions, the psychology of teaching, and the social psychology of schools as organizations. And also, educational psychologists can deal with gifted children, gifted students, and children or students with disabilities. And in our way to define educational psychologists, we differentiate or discriminate between two types, two subtypes, educational psychologists and the school psychologists. And as we said before, if in United States there is a very big difference between them. If you are doing research, in that case you are educational psychologist. So according to them, educational psychologist may be classified as a basic psychologist or basic psychologist, not as an applied one. And if you are trying to put this data, these results of this research into practice, if you are trying to apply them, these results, in that case, you are referred to as a school psychologist. But in Egypt, no difference between educational psychologists and school psychologists. So you can use them interchangeably. Now, we have to move to the new section today. What about clinical psychology? The clinical psychologists work in a variety of settings, including hospitals, clinics, and in private practice. Some specialized in the working with mentally handicapped, physically handicapped, or drug and alcohol abusers, or geriatric patients. In some settings, a clinical psychologist works in tandem with a psychiatrist and a social worker and is responsible for conducting the team's research. Clinical psychologists also serve the courts in assessing defendants. What about the definition of clinical psychology and the clinical psychologist? We can define clinical psychology as a branch of psychology concerned with the diagnosis and the treatment of mental disorders. And you should be acquainted with the difference between clinical psychology as a discipline and abnormal psychology as a different discipline. The abnormal psychology is not an applied science, it is a basic science. In abnormal psychology, we can understand, we can describe, we can discover the laws and the principles that related to psychological disorders and abnormal behavior. But if we are trying to apply the results of abnormal psychology research, in that case, we are moving to the clinical psychology. In clinical psychology, we are trying to help humans in one way or another. And in that case, we have three ways to help them. Number one, diagnosis. Number two, treatment. Number three, prevention. Now, what about the definition of clinical psychologist as a professional in this area or this field? the definitions of clinical psychologists in the following three slides. So we can define clinical psychologist as the psychologist who evaluate patients through interview, observation, and psychological tests, and they apply current research findings and methodologies in making diagnosis and assigning treatment. And also, number two, we can define clinical psychologists as the psychologists who are concerned with the mental welfare of individuals by applying the principles of behavior and experience to the problem of adjustment. Number three, clinical specific abnormal behavior, odd experience, deviant behaviors, maladjustment, anxious behavior, and so on. Number four, they hold an academic degree, PhD, for example, or any different psychological degree, such as master degree or diploma of clinical psychology, but they don't have a medical degree or MD. Number five, they may provide psychotherapy but cannot prescribe medications. Number six, or clinics or in private practice work. Number seven, they work often in tandem with psychiatrists and social workers, psychiatric nurse, neurologist, physiotherapist, speech therapist, and so on. And we mean by in tandem with, we mean by this expression, they are teamwork, one teamwork, the teamwork of mental health. Clinical psychologists classify their basic activities under three main headings: assessment, including diagnosis, treatment or therapy, and prevention. And we may add a fourth task. It is research or clinical research. In assessment, clinical psychologists administer and interpret psychological tests either for the purpose of evaluating individuals' relative intelligence or other abilities or capabilities, or for the purpose of eliciting mental characteristics that will aid in diagnosing a particular mental disorder. The interview, in which the psychologist observes, questions, and interacts with the patient, is another tool of diagnosis. What about the definition of assessment? Assessment of intellectual functioning and personality traits or personality characteristics. So, in assessment, psychologists are interested in assessment of intellectual function, intellectual abilities, mental functions, and personality traits or personality characteristics. And it may be this assessment may be in the form of number one, observation, number two, testing by using tools, psychological tools such as intelligence scales or personality questionnaires. Number three, interviewing by asking the patient and interacting with the patient. But in either case, it is a way of gathering information so that the problem can be solved. And the assessment, as we said, is a way so that a problem can be solved. You cannot solve the patient's problem if you not able to gather information about his personality, his attitudes, his intelligence, his cognitive abilities, and so on. And this information may help, number one, in reaching a better diagnosis. Number two, determining the efficacy of a specific therapeutic technique, for example, by using pre and post testing procedures. For example, if I am interested in treating the phobic reaction, I should have pre-assessment. In this pre-assessment, I will assess the severity of symptoms, and then and the third step is post-assessment. In post-assessment, we reassess the symptoms, and if we have difference between the pre-assessment and the post-assessment, in the favor of the post-assessment, in that case, we can say that the therapy has efficacy. And the third use of this information that gathered in the assessment, solving some research problem. And this is related to the fourth task, the fourth activity of the clinical psychologist, which we were referred to as research or clinical research. Now we have to move to therapy. For purposes of treatment, the clinical psychologist may use any of several types of psychotherapy. Many psychologists take an different approaches. For example, they may be specialized in behavioral therapy, group therapy, family therapy, psychoanalysis, client-centered therapy, and so on. Now, what about the definition of therapy? What do we mean by therapy? We can define therapy as it includes any technique or recommendation for improving the adjustment of the individual. And it may be done person at a time, per session, one person per session, or groups per session, per one session. It may last for just a few sessions or go on for years, such as psychoanalysis, and it may focus on a specific problem, for example, stuttering, phobia, depressive symptoms, or maybe focus on the entire personality, all the entire personality of the person. And we have some forms of therapy. For example, psychoanalysis therapy is for insight into the origins of the one's problem. They are not interested in the symptoms, but the origins of the problems, and they assume that these origins of the problem, which served by one's undesirable behavior, are located in the unconsciousness. So they differentiated between consciousness, unconsciousness, and in between we have subconsciousness. What about the second type or the second form of therapy, client-centered therapy? This therapy focus mainly on the relationship between the client and therapist. This relationship designed to produce an atmosphere of trust, which will help the patient to solve his problem. So the main issue in this kind of therapy is the relationship and the atmosphere between the client, the patient, and the therapist. And the third form of therapy, which is referred to as behavioral therapy or behavior modification, this kind of therapy is related to a very big approach, which is referred to as behavioralism. Behaviorism. Behaviorism is a highly influential academic school of psychology that dominated psychological theory between the two world wars. Classical behaviorism, prevalent in the first third of the 20th century, was concerned with measurable and observable data, and in behaviorism, the organism is seen as responding to conditions, which is referred to as stimuli set by the outer environment and by inner biological processes. Behavioral therapy was guided by this approach. It assumes that if the therapist teaches the patient some sort of activities that he will be able that will enable these activities will enable him to deal with his problem, the symptoms decrease and may disappear. For example, relaxation, which decrease phobic reactions by activating parasympathetic nervous system and deactivating sympathetic nervous system. Now, to summarize, we said we have three main tasks of the clinical psychologist. Number one, assessment, including diagnosis. Number two, therapy or treatment. Number three, prevention. What about prevention? If you are trying to define the word prevention, it is referred to the act of preventing or hindering. And if we define it by any medical dictionary, it will be defined as the keeping of something, such as illness, injury, from happening. Keeping from happening. We have three types of prevention. The first degree of prevention, which is referred to as primary prevention. The second type of prevention, which is referred to as secondary prevention. And the third type of prevention, which is referred to as tertiary prevention. Primary prevention is the first level of health care designed to prevent the occurrence of disease and promote health. So we have to prevent it before it happens. But if we fail to prevent those people from developing the psychological disorder, so we have the second way or the second level of health care, which is referred to as secondary prevention, which is based on identifying of disease in an early stage, and we try to treat it and manage it before it it is being chronic disease. And the third type of prevention, or the third phase, or the third level of health care or prevention, concerned with promotion of independent function and the prevention of further disease-related deterioration. So our main focus is how to deal with the disease after it becomes chronic disease. Now, we will try to put simple definition for each phase or each level of healthcare or prevention. What is the definition of primary prevention? It means reducing the mental disorders in a community through, we have some ways such as number one, mental health education. Number two, improving physical, psychological, social cultural supplies. Number three, enhancing people's capacity to cope with crisis. What about the second type of prevention? Secondary prevention. It means detecting and treating of problems at an early stage while they are still manageable and before they become resistant to intervention. What about the third reducing? It means two issues. Number one, reducing the duration of the disorder. Number two, reducing the negative effects that related to relapses of mental disorders after their occurrence. Now we have two remain points. Number one, what about the counseling psychologist? And number two, what about the psychoanalyst? What I would like to focus on regarding the counseling psychologist, what is the difference between counseling psychologist and the clinical psychologist? Both are applied psychology. But in clinical psychology, we are dealing with patients. Already they develop the disorder, psychological disorders. So they are clinical groups. But in counseling psychologists, we may be deal with normal individuals or subclinical groups. So we can define counseling psychologists as the psychologists who work with normal or moderately maladjustment individuals. They are clinically free. They are not clinical groups. But maybe in the future they develop clinical disorder. And as in clinical work, we can have group psychotherapy and individual psychotherapy, one person per a time, per a session at a time. Also in counseling psychology, we may have group counseling and also we may have counseling with, what I mean by individuals, one person at a time or one person per a session. What about psychoanalysis is a system of understanding and treating mental conflicts and disorders developed by Sigmund Freud. And they differentiate between consciousness, unconsciousness, and the subconsciousness. And they have some methods such as free association. In free association, the patient can say what he would like to say. And transference phenomena, it means feelings between therapist and the patient. And psychoanalysis used mainly for treatment of neurotic disorders. We have two main types of psychological, two big types of psychological and psychiatric disorders. The first one is referred to as neurotic disorders or neurotic problems or neurosis, such as reactive depression, such as obsessive compulsive disorder, hysteria and anxiety, post traumatic disorder. But we have a different type. It is referred to as psychosis or psychotic disorder, psychotic problems, which are characterized by thought disorders, such as paranoia, schizophrenia, such as the depressive manic disorder, mania, depression, but not reactive depression, because reactive depression is classified as a neurosis or a neurotic disorders. What I would like to focus on that as psychoanalysts themselves say psychoanalysis mainly used for treatment of neurotic disorders, but not for psychotic disorders. That's all about the different subtypes of applied psychologists. Already we covered some about sports psychologists, industrial psychologists, educational psychologists, military psychologists, and in this video, we covered some about clinical psychologists, psychoanalysts, and the counseling psychologists. Thank you.